Good afternoon, members of the fourth estate. Present here are members of parliament from Kiambu County, and we wish to issue a statement on the status of health in Kiambu County, the crisis that is there in the hospitals. And after this statement, if there will be any questions, and members may be able to comment in the different languages so that you can be able to reach as many people as possible. So allow me to read the statement as follows. Kiambu health crisis, a collapsing system, abandoned patients, and a governor at war with doctors. Kiambu County, once known for its proximity to the capital city and historically reliable access to public services, is now engulfed in humanitarian emergency within its health care system. What is unfolding is not a temporary disruption or administrative hiccup. It is a systematic collapse driven by negligence, arrogance, and the remarkable failure of leadership under the Governor, Kimani Wamatangi. For months, the country's health infrastructure has been paralyzed by persistent doctor strikes. Instead of pursuing dialogue with health professionals, the governor has adopted an openly confrontational stance marked by threats, intimidation, and public posturing. Efforts at negotiating have been rejected. Unions' concerns have been brushed aside. Specialists raising alarm have been met with hostility rather than engagement. As a result, the public health system is now teetering on the edge of total failure. The consequences of this standoff are unprecedented in the era of devolution. In response to the county's continued hostility and leadership paralysis, the national government withdrew 697 medical intern doctors who had been posted to various facilities within Kiambu County. The withdrawal alone would have been devastating, but the situation worsened when the fresh cohort of medical interns expected to reinforce county hospitals were deliberately reassigned to other regions, bypassing Kiambu completely due to its toxic working environment and deteriorating relations with the county authorities. Those who remain in the system, nurses, clinical officers, specialists, and support staff, are either on strike or trapped in intolerable conditions with no meaningful support from the county government. The message has been painfully clear. Kiambu is either incapable or unwilling to manage its health functions. At the heart of this collapse are the county's largest referral facilities, Kiambu Level 5 Hospital and Thika Level 5 Hospital. These centers, which should be serving thousands of patients each day, have been reduced to shells of inactivity and despair. Wards are deserted and completely unmanned. Patients wait in long queues only to discover that no medical personnel are available to attend to them. Operating theaters are silent, pharmacies are unstocked, maternity units are overwhelmed, and essential equipment gathers dust as emergencies go unanswered. It has become tragically common to see relatives shuttle their loved ones from one hospital to the next in search of help that never comes. Many, driven by desperation, have resorted to hiring private ambulances to Nairobi, Machakos, and Murang'a counties. What began as a crisis has now hardened into a catastrophe. Behind the muted public statements and political posturing are gleam statistics that reveal the true scale of the disaster. From the media today, you could read that at least 136 infants have died in neonatal and pediatric wards due to the absence of personnel to administer care. No fewer than 20 mothers have lost their lives during childbirth or for preventable post-delivery complications, cases that not have been turned fatal if basic medical supervision had been available. Emergency referrals to neighboring counties have become journey of last resort, with some patients collapsing and dying on the way. These are not acts of fate, but the direct outcomes of leadership that chose coercion over conversation. Families are mourning loved ones not because diseases are unstoppable, but because governance failed when it was needed most. Kiambu County is home to over 2.5 million residents who depend on public health care services. Yet today, access to medical care is uncertain, dangerous, and in some places non-existent. When a devolved function becomes a threat to human life, the nation cannot look away. For the sake of those who live and suffer in Kiambu, there must be an immediate and decisive intervention. The only realistic life-saving path for it is for the national government to assume control of health function in Kiambu County moving to 2027. This is not a political maneuver, it is an act of rescue. The Constitution makes provisions for national intervention when a county fails in its basic obligation to protect its people. Kiambu has not only demonstrated immense incompetence, but has shown no willingness to resolve the ongoing stalemate. Devolution was not designed to shield impunity or justify the abandonment of citizens. The Kiambu Governor, Wamatangi, has created a vacuum where leadership should exist. Dialogue has been replaced by diktats, cooperation has substituted with coercion, and humility eclipsed by intransigence. The withdrawal of interns, the collapse of key facilities, and the mounting death toll are fruits of stubbornness rather than resource scarcity. This is not a failure born of poverty, it is a failure born of pride. Healthcare is not a campaign slogan, it's a constitutional right, a moral obligation, and a lifeline. In Kiambu, that lifeline has been severed. Every additional day that this crisis continues brings more grief, more preventable deaths, and more irreversible loss. Infants will continue to die before they take their first breath. Mothers will continue to entering labor wards with hope and living in caskets. Patients will continue collapsing on cold benches while waiting for doctors who will never come. The suffering has already gone on far too long. If the county government cannot protect its people, then we urge the national government to come in and intervene. Not tomorrow, not next week, but immediately. Anything less amounts to complicity in the continued loss of innocent lives. So that is our message, signed by members of parliament from Kiambu County.
We are telling the governor it is time. Other counties are also benefiting on SHA. Ukienda kama counties zingine ambazo zimetuzunguka, unasikia kwamba watu wanatengenezwa bila kulipa chochote. Kiambu it's the only county saa hizi as we speak. Ukienda hospitali unaitishwa pesa, sijui pesa ya registration, sijui unaambiwa ulipe dawa, but out level 1, level 2, level 3, they are not supposed to be charging anyone a coin or anything. Unaingia hospitali, unatengenezwa, all those claims zinapelekwa kwa SHA, SHA inaripa hizo pesa ambazo zimekuwa ziki by 14th of every month zinapeana hizo pesa to every hospital. So if you look at our hospitals in Kiambu County, we realize we are not benefiting also. We are contributing to SHA, but we are also not able to benefit maximally zile pesa ambazo zinafaa kutoka katika SHA ambazo zinatengeneza watu wetu.
And one of the things that we have been taking seriously is to consult and to ask ourselves how many people ought to die so that we can have a meeting like this. We are talking of many young people. We are not talking of their parents, the other households who have been affected. So we are talking of a national crisis. And this is a matter that is beyond politics. When we have people dying, these people who are dying, they are not aligned to this or the other side. And we should take this matter seriously because the county government of Kiambu, led by the governor, they don't seem to have an answer. And if they do, they don't care.
And these children have died in Kiambu County, and we cannot we mute ourselves or we stay mum, and we know that we are really suffering. And I really want to tell you people of all the state, for sure, just visit Kiambu County at a random. You just go there and see exactly what is happening. They might try to do a lot of PR because the doctors have come out clearly to say that they have not been going to work for 127 days. We have seen so many dead parents crying from Kiambu County, and the governor keep on saying that it is politics. Some of the lives of people can never be politics. Bottom line, 136 infants have died in Kiambu County, and those are only 2 hospitals. You have heard there are other 10 hospitals that have not been included. So if you include those other 10 constituencies, it will raise this number from 136 to 500, meaning many homes are mourning. And if you don't do something right now, and I'm saying if Kiambu County government cannot be able to handle the function of health, the national government is there. The national government can step in and take care of those hospitals.